Hello, this is Dr. David Behling with Life Restore MD again. This is one in a series of videos that I'm making for my patients or people who are interested in becoming my patient to answer common questions that they have and maybe save them a trip into the clinic. One of the most common questions I get is about supplementation with things that they can get over the counter, either at their local pharmacy or GNC and vitamin shops and things like that. They want to know if that will affect their testosterone level, either for the labs that we have to draw to assess it, or can it honestly help them? There's two types of supplements in this country. All right. The first are safe, and they generally won't hurt you. The problem is that they don't do a lot to help you either. All right. What they do is they provide you building blocks for the androgens that you're trying to increase, that's testosterone, or the growth hormone release, or to increase your energy and the creatinine, phosphodiesterase pathways. They give you the building blocks to make these. The problem in the United States is that most of us aren't malnourished, and it really doesn't do anything except add extra calories to our diet if the manufacturer put too much extra sugar in there to make it taste good. I said it generally doesn't hurt you. Well, it can hurt you in one place, the wallet. Be careful how much you spend on those. Now, the other type of supplements are ones that can indeed make a difference with regards to whatever system we're trying to augment or increase, including testosterone, growth hormone, energy. These are supplements with active metabolites in them, and in this country, we do not carefully regulate anything designated as a supplement. All right, the FDA doesn't have any particular rules about that, at least to get it on the shelf. So what happens is sometimes, it's not that the manufacturers purposely put cocaine into their energy drink, it's that they're using stimulants that can metabolize into an active metabolite, similar to something like cocaine or an amphetamine, and give that boost. All right. The same is true for androgens as well. So when people stumble across these, they actually do improve their symptoms. The problem is they're dangerous. Because whenever we take something orally, it goes through what's called first-pass metabolism. That means through our stomach, through the the portal bloodstream, into the liver where it gets partially metabolized. That's what the liver is. It's a big filter that protects us from poisons and toxins. And then it goes into the bloodstream. When you take something orally, you can take an awful lot of it, and the liver can get damaged. All right. So that's the risk with those. Eventually, the FDA catches all these things and takes them off the market. So those are the two types of supplements. In general, I tell my patients not to worry about it. By far the most common one are the first kind that aren't dangerous but don't do much for you, in particular your testosterone level. So generally the advice is don't worry. You don't have to be off your supplement for any particular amount of time before we can do our labs. All right. I hope this video was helpful for you. Again, I'm Dr. David Behling with Life Restore MD. If you have more questions, please feel free to look at our website, liferestoremd.com. That's liferestoremd.com. Check there for information. Feel free to give us a call if you have more questions. All right. Life Restore MD. Be your best.